Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Antiretroviral therapy. It denotes the use of pharmacologic agents which are effective against HIV, human immunodeficiency virus, which belongs to the class Retroviridae. That's why we are calling this as antiretroviral therapy, which is used chiefly in HIV positive patients. It is a lifelong therapy. First, we have to counsel the patient about this. They should be using this treatment for their entire life. Next, prevention of parent to child transmission of HIV. Pre and post exposure prophylaxis. What are the goals of ART? Obviously, to reduce the viral load in the patient to less than 50 copies per ml. As it is impossible to completely eliminate the virus, our goal is to reduce at least to less than 50 copies per ml. Increase CD4 cell count, obviously, which increases the immune status of the patient. To prevent transmission and drug resistance. If we start ART in everyone, whoever got positive then and there, irrespective of age, gender, pregnancy status, so that they won't go and spread the disease. Chances will be less. Then if we are giving multi-drug therapy as ART, so that virus will not develop resistance. So our goal is not to prevent drug resistance, to prevent transmission, and to increase the quality of life. In adults, first line regimen is tenofovir, lamivudine, emtricitabine, lamivudine or emtricitabine, and dolutegravir. 2 NRTIs and another class of drug. In children, ABC. ABC means abacavir, lamivudine, dolutegravir. Remember like this, children will learn ABC. Neonates, atazanavir, lamivudine, raltegravir. In pregnancy, tenofovir, emtricitabine, raltegravir or dolutegravir. Even in pregnancy, if anyone got HIV positive, immediately we have to start drugs. In newborn, as prophylaxis, we will give nevirapine. Newborn nevirapine for 6 to 12 weeks. Before starting ART, we will do investigations: CD4, viral load, CBC, RBS, LFT, RFT, lipid profile, any other comorbidities or other infections like TB, hepatitis B, C, diabetes and hypertension. To monitor any adverse drug reactions or adverse effects of the drug. Coming to classification of ART. First, virus will enter the cell to attack the cell using the main door, that is main receptor CD4. So we can block at this level itself by giving entry inhibitors or fusion inhibitors, enfuvirtide and meravirac. Meravirac blocks co-receptors like CCR5. Next, reverse transcriptase inhibitors. After virus enters the cell, it will release its RNA, which is single-stranded. It has to get converted to DNA, double-stranded. So it is doing exactly opposite thing. Normally DNA will convert to RNA. Now it is doing in reverse. So that's why this enzyme is called reverse transcriptase, converting viral RNA to viral DNA. These are two types, NRTIs, NNRTIs. NRTIs also known as nukes. Emtricitabine, abacavir, lamivudine, zidovudine. Nucleotide reverse transcriptase inhibitor is tenofovir, disoproxyl fumarate, alafenamide. These are all comes under nukes, NRTIs. Coming to non-nucleoside reverse transcriptase inhibitors, efavirenz, nevirapine, rilpivirine, delavirdine. Now our virus has become double-stranded DNA. Now it will get integrated into our own cellular host DNA by using enzyme integrase. After this, they will use our machinery to produce their babies, that is virions. Integrase, TEGRA, tigre, raltegravir, bictegravir, dolutegravir, elvitegravir. This class we can easily identify by this word tigre. Next, protease inhibitors. Now our viral DNA has incorporated into host DNA. Then using protease enzyme, they will form new virions. Protease will break down proteins into small particles, which will form new virions. Here we can inhibit this enzyme protease by giving atazanavir, amprinavir, fosamprinavir, darunavir, lopinavir, ritonavir, indinavir, nelfinavir, saquinavir. These are all protease inhibitors. A new class called biologics is also there, which inhibits entry of the virus. Example, ibalizumab, which blocks the main door, that is main receptor, CD4. How we will give this? As a slow IV infusion, 2000 mg stat. It has long T-half, so 2 weeks no need to give anything. After 2 weeks, bi-weekly we will give 800 mg ibalizumab, which is a biological which comes under antiretroviral therapy. Cobicistat, it's not an ART, but it will boost ART drugs like darunavir, elvitegravir, atazanavir. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.